All right, good morning, and thank you for joining us for December's Pennie Community Workgroup. My name's Scott Yeager, and we have an absolutely packed session today with a lot of good information. We are going to remind everyone that this is a recorded session. If you have questions, please utilize the question and answer function. We have Pennie staff here who can help answer questions. For those questions that may require a little bit more investigation, we'll be sure to respond in the Q&A after. Today's agenda might not seem that big, but trust me, there's a lot of good information here for us. We're going to go over very briefly some community partner updates. We have a lot of good stuff in terms of operations and systems enhancements to go over today. And again, we will try to answer as many questions as we can during this session. It's important to note that our community partner meetings have their own website. It's agency.pennie.com/Pennie-community workgroup. It's very easy to find the materials, and we're going to kick it off with just a reminder that we are in open enrollment November 1st to January 15th. We have a very important deadline for January 1, 2023 coverage coming up, and that's December 15th. With that, please know that Pennie's marketing and communications team has been on top of things in terms of getting the message out about that December 15th deadline, and we have an awareness push right now. In terms of owned media, there are daily emails that are going out to customers and outbound calls going out to customers. We want to make sure that everyone has an opportunity to review their coverage for 2023, to shop and compare plans, and to connect with the health and dental insurance options that are best for them. Also, we have a social media countdown campaign. That campaign is something that we encourage everyone to share. From an earned media perspective, there has been an extensive push for TV and radio interviews, and that's going to be leading up to that 12/15 deadline. Again, if you happen to hear one of our interviews or have an opportunity to share, please do so. Press releases are going to be distributed 12/12 in an effort to, again, make sure that there's another layer of awareness in our communities. And through paid media, we're increasing our advertising leading up to that 12/15 deadline. For customers who need assistance, or for brokers or assisters who need assistance, November 1st through January 15th, Pennie's Contact Center will be open Monday through Friday, 8 a.m. to 7 p.m. Saturday, 8 to 1. We're closed on Sunday. We do have extended hours on December 15th from 8 a.m. to 10 p.m. And on Sunday, our deadline for open enrollment is 1/15/23. We'll be open from 8 a.m. until 11:59 p.m. In terms of holiday closings, we will be closed. Of course, we were closed for Thanksgiving. Christmas Eve will be closed. Martin Luther King Day, we will be closed. But an important thing to note is Pennie will be open 12/26. The observation of Christmas Day, and the contact center will also be open on 1/2, New Year's Day. I wanted to, again, just mention that Pennie's Health Equity Tour with the YMCA is up and running. The website that you see here will be included in this resource deck. If you click there and find a Health Equity Tour stop that you would like to join, please consider yourself welcome. These events are open, and we encourage participation from our community partners. Pennie's Toolkit, again, another layer of sharing. The resource link is here. You'll find all kinds of good stuff to share, from newly developed materials to updated materials that can help bring awareness not only to Pennie, but to the health insurance and financial assistance options that we have available. An important reminder in terms of our assisters and brokers who are recertifying for plan year 23. If you have not taken your recertification as an assister or a broker by December 15th, please do so. Encourage your colleagues to do so, because we want to make sure that all of our assisters and brokers are where they need to be in terms of their training and certification, especially heading into 2023, which will be a very vital year for all of us. Again, the Pennie Community Workgroup materials are posted online. This meeting is recorded as a resource. The deck is shared as well as the resource links. So please make sure that you visit agency.pennie.com and just click on Workgroup. It'll take you directly to the resource page. With that being said, I'd like to turn things over to my colleague, Joe. Joe and Hannah Turner have some very, very exciting updates to provide you. And with that being said, Joe, I'd like to kick things over to you.
Thanks, Scott. My name is Joe Pamula. I am with our insurer operations team, and I'm going to walk through our provider search tool with everyone. We've had some customers struggling with trying to determine whether their physician or facility was in network. So we just thought we would walk through how to use the search tool, share some tips and best practices, as well as some common mistakes that we've seen. So when shopping for a health plan, our integrated provider search lets you see which plans and insurers your provider or hospital would be in network with. And you can use our search tool in two ways while you are doing anonymous shopping, which is, browsing for plans you don't necessarily need to be logged into for that, or when you're walking through the application process and actually shopping for a plan with the customer's account. Scott, next slide. So these screens should be familiar if you go to enroll.pennie.com and click Browse for Health and Dental Plans, as shown on the left-hand screenshot. Then on the right-hand side, you'd enter the year you're shopping for, the zip code of the customer, and select Browse for Plans. Scott, next. So at this point, we give you the opportunity to talk about your healthcare needs. And the first one that you come across is providers that you'd like to search for. So the default is doctor within a 20-mile radius. So that zip code is the zip code that I plugged in my first screen. And you're going to start typing your physician's name in. And just like predictive text on your cell phone, you're going to get a list of suggested physicians based off of what you typed. So you're going to select the physician. You're going to want to make sure that you check this, that you're checking for the correct provider specialty. In this case, I'm looking for that internal medicine, Dr. Davies. And it's important to note that providers often have multiple locations. They might participate with a particular plan at one location and not with the other. So it's really important to select the correct address. So once you click on the name, and then you'll be given the option to select the address. So on the right-hand screen or right-hand screenshot, you'll see that I selected the 805 Sir Thomas Court address. And just worth mentioning as well, the default search radius is 20 miles from the center of the zip code you provided. So if your search results don't necessarily give you what you're looking for, you can tweak that search radius to go wider or smaller, and just being aware that it's coming from the center of that zip code. So if you're right on the edge of that zip code, you might need to plug in a different zip code, or like I said, widen that search radius. Okay, so here we're going to search for a doctor, which we have our displayed result for Dr. Davies that we're looking for. And now we're going to search for a facility. So you can toggle to search for a doctor versus a facility here. And we're going to look for a hospital next. Now, it's important to note that you can look for up to 5 providers and or hospitals at one time, any combination of those 5. And if you determine that you want to look for someone different, you can X out. Scott, if you go back once. See, if you can see on the doctor results, there is an X there. If you want to remove them from your search, you can, but you can do 5 at a time. And that includes multiple addresses. So if I wanted to look up Dr. Davies at this address and then another address, I could go back and search for her multiple times. Okay, thanks, Scott. So next we're going to look for a hospital. It's very important that when you're searching for a facility that you're looking for the facility that says General Acute Care Hospital. Hospitals can take up multiple city blocks as well, so it's also important to get the correct address. Scott, if you could, yeah. So on this slide, for example, when I typed in Holy Spirit Hospital, this is just a portion of the different addresses that come up. So it's really important to verify the address that you're trying to locate for that hospital. And if all else fails, check multiple addresses. Okay, so on this slide, this is our results of what we plugged in for our search, or this is the criteria for what we're looking for. We have the 1 doctor and 1 facility. So when we go into shop, Scott, if you could jump ahead one, these are the tiles that you commonly see. And if you look at the bottom, it has our doctor and our hospital. The green check obviously means the doctor or hospital is in network and participating with that particular insurer with that particular plan. The circle with the slash through it means they are not considered participating or in network. So you can see the first 2 tiles are the same insurer. However, because the plans are different, Holy Spirit is participating with one but not the other. That's why it's so important to check each one individually, each plan individually. You can't assume that just because it's one carrier that that a provider or facility would be covered across the board. Okay, and this is kind of like the step 2 or double check on the provider search. When you go into the plan details, the screen you see to the left, these are the details of the plan. And you can see at the bottom of that slide that it shows you the physician and hospital displayed, showing in network for the doctor. Hospital is listed as out of network. Now, there is a link to the provider's directory. When you click on that link, it's going to take you to the insurer's provider directory, which in this case, I provided a screenshot to the right. What's nice about this is if you see in the top corner, it lists the location based off that zip code that I plugged in at the beginning, as well as the network for that plan. So this is an EPO plan, and you can see in the top right hand corner, it says Capital Advantage EPO. So it already drills down for you. So whatever search you do on the insurer's directory is going to definitively be in network when you're searching there. It's also important to note that even though dental plans aren't included in our integrated provider search, the provider directory link on those plan details will take you to the dental provider's provider search. Okay. Just some helpful hints. Try searching for the provider's full name. If unsuccessful, try adding the middle initial. If you did include the middle initial, perhaps take that out. Like I said, when you type in the name, you're going to get a list of suggested results based off of how much you type in. You're going to get different things. So you're going to want to provide as much detail as you can to get to where you need to be. And like I said before, be sure to verify the address that you're selecting is correct, because many doctors have multiple locations, as well as verifying that the specialty of the provider or facility that you're selecting is correct as well. And this last bullet is paramount. Regardless of the search results on Pennie's website or the insurer's website, you should always reach out to the provider's office directly to confirm their participation. So it's really a triple check. There's our provider search, there's the carrier or insurer's provider search, and then you want to confirm with the physician themselves. So there's multiple ways to confirm that a provider would be in network. And that's all I had. I don't know if there was any questions that were specifically geared towards the provider search.
Hey, Joe, it's Hannah. No, I think we're good. There might be some in the chat that you might want to address, just to reiterate some of the things that you've discussed, and then we can circle back to the end if there are some that you want to reiterate.
Got it. Okay. At this point, I'm going to turn it over to Hannah to discuss family glitch.
Thanks, Joe. So we've had some requests to spend a little more time talking about the family glitch fix. We did talk about this back in September, in our September 2022 work group, but we've had some additional questions on this since it's been implemented. And so we wanted to take today to do a bit of a deeper dive on this, and based on questions and feedback we've received. So for a very quick recap, the so-called family glitch is how the ACA originally determined whether someone had access to affordable employer-sponsored coverage. So prior to 2023, someone was considered to have access to affordable ESI if the cost of employee self-only coverage was affordable. And it didn't matter how much the cost was for the family members to enroll. All of the family members would be ineligible for financial assistance if the cost for just the employee to enroll was affordable. And so that's caused a lot of people who, were to not be eligible for financial assistance through an exchange because their employee cost for their ESI is affordable, but the family cost of the ESI is not affordable at all. So what the recent rule changed starting in 2023, the ESI affordability is going to work a bit different, probably the way we kind of all expect it to work. So for someone who is the employee being offered employer-sponsored coverage, there's no change to the affordability rules for them. Their affordability is based on the cost of self-only coverage. So that's going to be the same as you've been doing for the last since 2014. But what's new is that the affordability of ESI for family members is going to be based on the actual cost of family coverage, which is new. And that's going to make a lot of folks who were previously ineligible for financial assistance now eligible for financial assistance because of that new measurement of affordability for family coverage being based on the actual cost of family coverage. That's why it's called the family glitch fix. So Pennie has implemented the new rules here in our 2023 application. So you'll start to see those new questions. We'll talk about what the application looks like. And for reference, the ESI affordability threshold, that does change slightly every year. This for 2023, it is 9.12% of income, meaning the ESI is considered affordable if the cost to enroll is less than 9.12% of your household income, and it's unaffordable if it's more than that. So if you want more on the introductory stuff on family glitch, it's in the September 2022 work group. So we've got linked there. Next slide. So today we're going to focus and deep dive into some of the more details of, we're going to talk about customers that have multiple offers of ESI. We're going to talk more about minimum value and what that means. And then how you determine the cost for family coverage, as well as how you will complete the Pennie application for some of these scenarios. So next slide. So for the multiple offers of ESI, we did do a few of these examples in September, and but just to reiterate, if someone is applying for coverage to the exchange and has an offer of employer coverage, more than one offer of employer coverage, they are ineligible for financial assistance through the exchange if just one of those offers of employer coverage is considered affordable and minimum value. So let's say they may have an offer through their own employer and their spouse's employer. If one of those is affordable and the other is unaffordable, it doesn't really matter that the other one is unaffordable. They have access to at least one employer coverage that is affordable and minimum value, which makes them ineligible for financial assistance through the exchange. So you don't have to really understand all the nuances there, because you need to enter all offers of ESI on the Pennie application, and then we'll do the calculations and make sure that, comparing when there's multiple offers of coverage. But so just make sure you enter all the offers of ESI on the application, because that can be an issue if one offer is affordable and the other is unaffordable. That will have an impact on their eligibility. Next slide. So we want to talk about minimum value. We've got a lot of questions around minimum value. And so again, the rule for ESI affordability says that someone is ineligible for financial assistance when they have an offer of affordable minimum value ESI. So minimum value, what does that mean? It means these first two things. It means that the ESI covers at least 60% of the expected total allowed cost for the covered services, and that the plan covers substantial coverage of inpatient hospitalization and physician services. This is in of itself is not a new definition. This has been around since 2014, minimum value. So it's not new. So it's something that actually folks should know about whether their ESI is minimum value, because employers have to tell their employees if the coverage is minimum value. So there's a couple different ways that the employers have to tell employees this. One is through the summary of benefits and coverage, and then the other is about through I think it's a one-time notice that employers have to provide their new employees around saying, there are marketplaces that exist and you may be eligible for premium tax credits. And that notice also has to include whether or not the employer offers minimum value ESI. So there are places that the employers already should be notifying the employees whether that ESI that they are offering is minimum value or not. And if someone is not sure, you should contact the employer, because the employer is the sponsor of the ESI and they have other reasons they need to know whether their coverage is minimum value. So the one thing that's slightly different, or can be slightly different, around minimum value under this new ESI affordability rule is you could theoretically have a plan that's ESI, where the ESI is minimum value for employees, but maybe it's not automatically minimum value for the family members of employees. So I only call this out because it's sort of nuanced and is not likely to happen, but there is a possibility of that happening. And the definition here is below from the regulations. I did link to the FAQs on this from the IRS. They do have some pretty good guidance there. But essentially, if the benefits of the health plan are different, if you are someone who is enrolled as an employee versus someone who's enrolled as a family member, then it might not automatically be minimum value for family members. But we're talking about things that are kind of not that common. Things like the family member, if you're enrolled as the employee in the ESI, you have access to hospitalization services. And if you're enrolled as a family member, you don't have access to hospitalization services, right? So it's those types of things. So there are some of these scenarios, pretty nuanced, but you're still should be going back to the employer to know who should be able to tell you if the coverage is minimum value. Next. So we'll talk about obviously what counts as the cost for family coverage. So the cost for family coverage is the amount that the employee needs to pay to enroll themselves, the employee themselves, and all of their family members who are offered ESI. So all of the family members. And you need to include all of those family members, regardless of whether or not that family member actually needs the ESI, plans to enroll in the ESI, or is even needs to, is seeking coverage through Pennie. It is truly all of the family members that are offered ESI. Now, family members is an important definition here, and it is just the employee, their spouse, and the spouse with a joint tax return, and their tax dependents. So there are sometimes, is the ESI might make some non-tax dependents could be eligible for ESI through an employee. If you're in that situation, those non-tax dependents, you cannot include the cost of those folks in the cost for family coverage. So probably the most likely scenario that is going to be, adult children who are under 26 and eligible to enroll with their parents on the ESI, but are, their own independent tax filer. And sort of the reason you don't include those non-tax dependents who are eligible for ESI is it has to do with how the offer of ESI is defined. So, and I would include that here. So when a non-tax dependent is offered ESI, that offer of ESI doesn't automatically make them ineligible for financial assistance. For the non-tax dependents, they have to actually enroll in the ESI for it to have an impact on their eligibility for financial assistance. But for the tax dependents of an employee, simply the offer of ESI is what could make them ineligible for financial assistance. It doesn't even matter if they were to enroll or not. So remember to not include the non-tax dependents, and we'll talk about that a little bit more. And then another question we received, was what about when the family members are offered ESI, but they can't actually enroll because the employee has elected not to enroll? Right, most ESI, the family members cannot enroll independently of the employee. So if the employee chooses not to enroll, the family members have an offer of coverage, but they can't actually take that up. And the IRS did address that in their reg rules and said that the family members in that scenario would still be ineligible for APTC, even though they don't have an opportunity to enroll. And the reason is because the employee made a decision to enroll or to not enroll, and that doesn't change the fact that the family members do have an offer of ESI, and these are tax dependent family members. So that will impact their ESI regardless of whether they actually enroll. So we'll dive into this bit. We've got a bunch of examples that we're going to go into in more detail that will work with some of those nuances on the family cost and who you include and who you don't include. But the other component is, what do you do when there are multiple plan options available to the employee through the ESI? And in that scenario, you would pick the lowest cost plan option that is minimum value. So if there's multiple options, you just pick the lowest plan option, lowest cost one, as long as it's minimum value. And before we go further into some examples I want to show here, we did also want to kind of call out a few things that we've seen folks doing on the application that were not expected, but just to make sure that people understand how to fill this out. So this really shouldn't be too complicated. You don't need to go and get your calculator and do a bunch of math. So we have seen some folks who thought, okay, well, the cost of family coverage must mean the amount the employee pays to enroll the employee and their family members, and then subtracting out the amount that the employee only would pay. You don't need to do that. It doesn't need to be that fancy. You're really just taking the cost to enroll the whole family member. So it's going to be the same thing the employee would see on their, benefit materials. It says this is how much you pay per pay period or whatever to enroll at a certain enrollment level. Okay. We didn't see a ton of that, but it was something we hadn't thought of before, and so we wanted to make sure we addressed it. So thanks, Scott. So next, we are going to go through an example here, and we had had some requests to get to some more complicated examples than we had done before. So we've got a household of 4 here, 2 adults and 2 children. One of the adults, Evan here, has an offer of ESI that through Evan's company. And all of the family members, all 4 family members, are offered this ESI through Evan's company. If you at the bottom, you will see the 2 plans that are offered by Evan's company, plan A1 and A2, for my creative naming here. But the first plan, you'll notice right off the bat, is not minimum value. So while that plan is the lower cost option, it's not minimum value, so we're basically going to ignore it for these purposes because we have to be only looking at plans that are minimum value. So the costs that we're going to use are the ones that are in the A2. So what we'll do first, you can go ahead and click next there, is look at Evan. So Evan is the employee of Evan's company. So for Evan, for employees, we only look at the cost to enroll just the employee. So in this scenario, that is the $200. The math works out that that's 4% of income, which is affordable. So because Evan's ESI through Evan's company as employee only is affordable, that would make Evan not eligible for any financial assistance or not eligible for APTC. Okay. So up to now, everything we just did is something that applied since 2014. Nothing has changed yet about how we've done this math. It's always worked this way. The way it used to work was you basically stopped after you did the employee and said, okay, well, the coverage is affordable for the employee, so it's automatically affordable for the family members, and we would just move on and none of them would be eligible for APTC. But we've got the new rules now, so now we need to look at the family members individually and using the real costs. So let's go to Sam, the spouse. So now with the spouse, we have 2 different ways that we could do this. We could say, okay, the cost for family coverage is to enroll the spouse is the employee plus spouse, because that would get the employee and the spouse enrolled. And that's the first of the lines I have here for the spouse. Hopefully, you are already saying to yourself, well, that doesn't make any sense because we've already talked about this, that the cost of family coverage needs to be the cost to enroll all of the family members in the tax household. So employee plus spouse costs don't account for the 2 children who are tax dependents and eligible for ESI. So alternative to using the employee plus spouse, which spoiler is the wrong answer, is you would choose the employee plus family rate because that is the family cost that covers all of the eligible family members. So go ahead and click next, and we're going to stick with Sam there, the spouse, having the employee plus family rate, which is $600, 12% of income, which is unaffordable, and now that makes the spouse APTC eligible. So you can see right off the bat, before we even go any further, we now have different eligibility for each person in the household. So Sam, the spouse, is now eligible for tax credits, whereas prior to 2023, under the previous rules, they would not have been eligible for tax credits. So click next and we'll do the children. They're actually, at this point, pretty simple because we've already done the hard work on the first family member with the spouse. And so every other family member gets the same amount because we've already figured out the one cost that we need to cover all of the family members. So the 2 children have the same eligibility as the spouse. The employee plus family cost is more than the 9.12% of income threshold, which makes the family coverage under Evan's company unaffordable for those 3 individuals in the household, which makes those 3 folks APTC eligible, but Evan, the employee, is not eligible for APTC. So click next, and we're going to make this one a little more complicated. Like I said, you guys wanted some more complicated, so we're going to do that today. So let's take that same scenario, and let's say now, in addition to the offer of ESI through Evan's company, we also have access to another offer of ESI through Sam's company, so the spouse's company. So we got the 2 parents, each have access to ESI through their own employers. So you still have to look at each offer of ESI individually. So we've already done the work for the first employer. So now let's look at for the second employer. So if you look at the bottom, you see Sam's company also offers 2 plans, but both of those plans are minimum value. So then we just look for which of the two plans is the lower cost plan, which is one on B1. So we're going to basically ignore the other one. So B1 is the one we're using because it is minimum value and it's the lowest cost. So we'll start with Evan, just because Evan's at the top of the list. Thanks. And because Evan is through the coverage offered through Sam's employer, that's family coverage. We already went through this math before. We need to, for anyone in the family, we know we need the employee plus family rate because we have a spouse and 2 children that need to enroll. So the only level that covers all of them would be employee and family. So through Sam's company, that coverage is unaffordable to Evan. But you'll notice there's no change to Pennie eligibility for Evan. And that's because Evan has access to, has 2 offers of ESI, but the first one is affordable. So it doesn't actually matter in this scenario whether the coverage through Sam's employer was affordable or not to Evan. Evan was already not going to be eligible for APTC because he has at least 1 offer of affordable ESI. So now we're going to move on to the Sam, which is the spouse in the first plan, but now Sam is the employee in the second with the second employer. So because Sam is the employee, we look at the employee only cost under the second offer of ESI, which is the $333, and that now is 7% of income, which is below the threshold, which makes that affordable. So now that ends up changing the eligibility for the spouse, because when we only had the first employer, the first ESI through Evan's company was unaffordable, but now the second offer of ESI that the spouse has access to is affordable. So that means that the spouse is now no longer APTC eligible. So both of the 2 parents in the household are not eligible for APTC because they have an affordable offer of ESI, even though it's in 2 different employers. Okay. And then we can go ahead and fill out thank you for the 2 children under the second offer of ESI through Sam's company. And we did the math already for Evan, so it's the same thing. And that is unaffordable. So for the 2 children, they have the same 2 offers of ESI, but both of those offers are unaffordable. So the children are still APTC eligible, even though the 2 parents are not APTC eligible. So everything on the exchange, we always have to look at eligibility by each person in the household. And, these kinds of things can happen where some members of the household are eligible for APTC and others may not be. So let's go back one, sorry, before we go through that. So we've done all this math. You don't have to ever recreate this spreadsheet of any sort, but I wanted to walk you through how this works, how the rules are applied in these different situations, and how we get to determining whether some coverage is affordable or not, and then the ultimate eligibility. But all you have to do is fill out the application questions, which will sort of guide you through this, and we'll do all this stuff in the back end. So we want to take this scenario where we have this household of 4 and the 2 offers of coverage. So we're taking our most complicated scenario here, and we'll walk through how you do that, how you would enter that in the application. So go ahead and go to the next slide for me. Okay, so this should look pretty familiar to you all. On the left, you see the left navigation for the standard financial assistance application. The questions on ESI affordability are in that last section, the additional information section. And you will go and answer these questions for each person in the household. So we're doing our first person in the household, which happens to be Evan. Was the first one entered on the list. And you'll see the first question is Evan being offered any coverage through a job? It could be their own job or a parent, spouse's, someone else's job. Are they offered any coverage through ESI coverage? So the answer there is yes. So what we're going to be doing for each person in the household, and for each offer of ESI, we're going to be answering basically these 4 questions that you kind of see along the top. So is that person in the household eligible for the ESI? And then if they are, before I jump ahead, when you say that you're eligible for ESI, you're going to automatically see a list of employers that populated. That's going to be pre-populated with based on information already on the application. Generally, it's from the income section, so that's every employer that you've previously listed and who the employee is. Not all real-world examples will be this easy to follow, where the company and the person's name are the same, but this it's helpful to see the employee's name with the employer name, especially when you do have some of these households where maybe the two the spouses work for the same company and they each have their own offer of ESI, and that can get a little bit tricky. So you do always see the employee name next to the employer name, which is especially helpful in those scenarios. So for Evan, we're going to start with his own company. So go ahead and do next for me. And we're going to enter, you see we checked off Evan's company, and we'll enter the employer details, simple, and then click next. So we are still working on Evan, and you see it's always going to be at the top of the screen that will tell you which family member we're asking about the offers of coverage available to that person. And so under Evan's company, does that company offer minimum value? And you'll answer yes or no. I did show here that the Learn More section has some more information about minimum value, similar to what we talked about. And I think we have some FAQs and stuff too, but there is some more information right there on the application when folks have any questions. So we know that this is minimum value, so we're going to go ahead and go to next. And then the last part of that, this part is entering the cost. And this is where we've seen some people struggle and get a little bit lost about which cost should I be entering at this point. And that's why I've got highlighted here sort of the different places that will be able to help you know who you're seeking coverage for and through which employer. So this is coverage for Evan through Evan's own employer. So that means we're looking for employee-only cost. The other way you would know that it's the employee-only cost is you see the question that's right above where you would enter the total amount. It says in there you need to, the plan that is available only to Evan. That only to Evan piece, that's going to be like sort of a keyword for you knowing it's also the employee cost, only cost. So you'll enter that amount, and then I've got shown here on the far right, there are many different frequency options. So when I was mentioning earlier, you don't need your calculator for this. You don't need your calculator for let's keep it simple. Whatever way the employer has provided the cost to the employee, just enter that and pick the right frequency. We'll do all the math for you. Okay. So now we've done one offer of coverage for one person in the application. The next is we still are on Evan, but Evan has a second offer of coverage through the spouse's employer. So that's where we check the spouse's employer name, and we're going to quickly go through the same questions. The employer information, and then hit next. We're going to do then the two big questions, right? Minimum value and cost to enroll. So we know this is minimum value coverage because we already talked about that earlier. And now the cost to enroll, this is Evan enrolling through his spouse's employer. So now we're talking about family cost. And the other way that you'll know is in the question, it does mention the cost for family plans for this person. So that's sort of another trigger for you, that we're talking about the family cost. And for that, we already know that that's the employee plus family cost for this family because they are need to cover a spouse and 2 children. So enter that amount, and then you're done. You've done both of the pieces for Evan's 2 offers of ESI. And now we go to the next person in the family, which is the spouse, Sam, so the other adult, who also has 2 offers of ESI. And so again, you're just going to go through for each employer that they have an offer of ESI, answer the minimum value question and the cost. And again, you have always on the left, it'll tell you which person you're on in the household, and then on the application, right above the cost section, will be the extra reminder. You'll see the term family cost. So you're like, yep, that's for the other, they're covered as a family member, not as the employee. So I need to put the family cost in there. So that's this was Sam through their spouse's employer. And if you click next, we do it for the Sam through their own employer. And again, the cost is showing that the cost is only to Sam. It doesn't mention family coverage. That's your other trigger that it's going to be an employee only cost. So it's really not that bad. It's just making sure that you remember kind of where you are in the application when you have these larger families and more than one offer of ESI through that. And then the 2 kids are going to actually be the same. Both of them are through, you know, they do have the 2 offers of ESI. It's both of those offers are through the parents plan. And so you'll see that in this scenario, both of the cost questions mention the family cost. So that's why you put the family cost in for each one. And then you're done. You've done 4 people in the household each with 2 offers of ESI. And then our system will do all of the complicated comparisons to income for each individual person and the multiple offers of ESI. And we'll get to the same result we did right before we did the application, but it's a lot simpler than doing a bunch of spreadsheets. So I wanted to go to now take the last few minutes here and go through some other flavors of this original household, and so for some other types of scenarios that you might see. So I'm going to go to the next slide. So this is example 3. So I've got the same household of 4 people, but instead of and for simplicity, I just took away the second offer of coverage. It still works the same if you have more than one offer of coverage. But we've got the same household of 4. And all 4 of them are offered ESI, but the spouse here, while they're offered ESI, they're eligible for it. They are not seeking coverage. They don't need the coverage through the ESI. They don't need coverage through Pennie. Maybe they have Medicare or something else. They are not seeking any coverage. So the question would be then, does that change what we should use as the quote family cost for the, in this case, it's the 2 children who are seeking coverage? And of course, and it shows on the screen, the answer is no, you do not change the cost for family coverage based on who is seeking coverage or not seeking coverage. The family cost is always going to be for all of the tax household members who are eligible for the ESI. So in this case, even though the spouse is not seeking coverage, has coverage from who knows where, the cost for family coverage for the children is still the same. There is no change to this. Going on the next slide. So let's take that family of 4 and let's tweak the tax household. So on the left, you'll see, let's say the spouse is not even part of the tax household. It's just Evan and the 2 children. So we're a tax household of 3. In that case, because the spouse is not in the tax household, the only family members in the tax household are the children. In that case, we would look to the employee plus children rate for the family coverage, because that's the cost to enroll the employee and all of the tax dependents in the ESI. And in that scenario, it actually happens to work out that because the cost for enrolling employee plus children is cheaper than the cost for employee and family, now the coverage through Evan's company is affordable for those children, and so they're not actually going to be eligible for APTC. On the right, I changed the household slightly the other way. So let's say it's just the 2 adults and there's no kids. So we now have a household of 2. Then that means for the spouse, they're the only tax dependent that needs to be included in family coverage. So we'd be using employee plus spouse for the family coverage rate instead of employee plus family, like we had to when there was the spouse and children. So the changes to who needs coverage doesn't change how you calculate the family cost, but if you have a different tax household makeup, then you would see different family cost structures. And then the last one is, let's say it's still the same family of 4. We still have the 2 adults and the 2 children, but the 2 children, they're eligible for ESI, but they are adult children. They're under 26, but they are not the tax dependents of our evidence SAM. So, I mean, that means that the tax household here is just the 2 adults. So it's actually exactly the same way you would calculate family cost as we did on that previous example where I didn't even have the kids on here at all. And that's because even though those children are eligible for ESI, and they may actually have enrolled in the ESI, you can't count them towards the family coverage cost. So even though if Evan wanted to enroll all of the family members in ESI, which include the spouse and the 2 adult children who are not tax dependents, that would require a employee plus family rate. But because those kids are not tax dependents, you can't include you can't use the employee plus family rate for, like in this case, for the spouse's affordability. You would only use employee plus spouse, and that's because those children are not tax dependents. So you really got to watch out for the adult children, especially who are not tax dependents. There's going to be other scenarios where you might have other people who are eligible for ESI but are not part of the tax household. And so you be careful. I think the adult children probably your most common scenario though. Okay. So that was a lot, but wanted to make sure we gave you guys some of those more nuanced scenarios that we had gotten some questions about, or things that we've seen people kind of struggle with on the application. And just a reminder that there are some of those links to like the September workgroup where we talked about this in a more basic level. And then those IRS FAQs are also a really good place to go for examples and other questions.
All right. Thank you so much, Hannah. Thank you, Joe. And thank you, everyone, for dropping your questions in the Q&A. Joe, Hannah, were there, we have some time for questions. Are there any that jump out?
Joe, were there any you wanted to circle back on provider search? Or
yeah,
there are others that you saw around affordability that you thought would be good to address?
As far as I know that there were a handful of comments regarding inaccurate search results or inconsistent results between what they see on Pennie search versus the carrier search. I did want to say that our search data is provided directly from the carriers. They do thoroughly vet that before open enrollment, before plans are added to shopping. But if you do find inconsistencies, please send them our way. Any kind of screenshots or examples, the more data you provide, the better it'll be for us to research those inconsistencies. We don't want those consistencies out there either. We want every customer and broker to have as much faith in our search tool as you would in the insurer's search tool. But that's why we give you those other kind of safety nets to check with the insurer, check with the provider themselves. But please get back to us on those so that we can clean that up on our end.
Yeah, thanks, Joe. And I mean, our insurers do spend a lot of time reviewing all that data before the open enrollment period begins, along with the like regular ongoing updates. But as Joe said, I think earlier, you know, the provider network information is changing daily. And so, but if you have issues, you can certainly report that, and you know, that will be helpful to everyone.
And Hannah, I saw that Cynthia had a question regarding minimum essential coverage. Her question is, do we calculate minimum essential coverage, or is that something that's noted on the employee's documents?
Yep. So the question of it, the MEC is not so much the issue. What you'll see on the documents that the employer should provide with their ESI will be the you know, whether that ESI is minimum value, and then the cost for the various tiers to enroll. Those are the two pieces that you need in order to complete the application. Essentially, it's considered MEC once it's determined its minimum value and affordable for them. That's when it starts to have an impact on them. So really, it's those two things that we talked about at the beginning. It's the minimum value, which should be on the SBC, as well as the notice required under the Fair Labor Standards Act, or the employee could ask the employer. They should have that information available. and then the costs, and you can just enter those directly into the application based on whatever frequency, however the employer communicates costs to the employees.
Fantastic. Fantastic. There was a question regarding how folks can submit suggestions. I am going to share a resource. It's agency.pennie.com/contact. You can send us a message if you have ideas for not only improving these sessions, but in this case, the individual was interested in submitting some information to help us improve our website. Again, we welcome your thoughts, we welcome your insights, and we truly do appreciate you joining us here today. Hannah, Joe, were there any other questions?
Yeah, I can. There's one other that I think is worth calling out. So the question was about how screening of ESI affordability works and whether the customer can be assessed at the time they file their taxes or at the end of the year. So the ESI affordability that we just went through is needed to determine the person's eligibility for financial assistance at the time that they're applying through the exchange. So because we cannot give someone APTC or CSR if they have an offer of affordable minimum value ESI. If that information is not included in the application, the person receives APTC during the year, then when they file their taxes, there is a part on the tax return when they are reconciling their APTC, which requires them to attest to their offers of ESI and whether that coverage is affordable. So if they did not provide the ESI affordability information on their application, it would come out on their tax return, and they could owe money back there because they would have received APTC that they were not eligible for. And so that's why it is really important to include that, combined with how quickly it can get complicated, that it's important to include every offer of ESI on the application. Even if you are certain in your head that that offer is not affordable, you should enter it to be sure that the customer is getting the correct eligibility, and make sure that they're not at risk of having to pay back, a very unfortunate surprise at the end of the year on their tax return. That's pretty disruptive to folks. So it is really important that we have all that information to get them the right eligibility at the time that they are applying.
All right. Well, thank you again, Joe. Thank you, Hannah, for all the good information. And thank you again, everyone, for joining us today for the Pennie Community Work Group. There was a question that came in. Yes, we will download the Q&A and have it posted to the resource site as soon as possible. For those of you who may have questions, if you're an assister or a broker, please know that you can reach out to 844-844-4440, or just email us at brokers@pennie.com or assisters@pennie.com. Thank you again so very much for the privilege of your time, and I hope you all have a peaceful week. Bye-bye.